Hello, my name is Sierra.
Hi, my name is Sydney.
So Sydney, can you tell me what is QSEN?
QSEN is an acronym for Quality and Safety Education for Nurses.
What does that mean?
Nurses who follow QSEN are constantly striving to improve their healthcare systems by focusing specifically on the quality and safety of the care they provide to ultimately provide a higher standard of care to their patients.
And how did QSEN originate?
QSEN was developed by the Institute of Medicine in 2005. The project received funding from the Robert Wood Johnson Foundation. The goal of developing QSEN was to address the challenge of preparing future nurses with the knowledge, skills, and attitude, abbreviated KSAs, necessary to continuously improve the quality and safety of the healthcare systems in which they work.
Wow, that's very interesting. This actually reminds me of the story of Josie King and why QSEN developed. In 2001, Josie King, an 18-month-old female, was admitted to the hospital for second or third degree burns that covered a significant portion of her body. While in the PICU, she had a central line placed to receive fluids. When she was discharged from the PICU, she was made NPO, but her central line was also removed due to a central line-related bloodstream infection. Due to this status, she was not receiving any fluids. Josie's mother soon realized that her daughter was losing weight, that she would scream when she saw water, and that she would suck on the washcloth when she was given a bath. Furthermore, Josie's mother constantly asked questions of the nurses, such as why her daughter was on NPO, but she was given no answers. She begged the nurses to let her daughter have fluids. Josie was also given inappropriately administered narcotics, specifically methadone, that caused her heart to stop. The order for narcotics had previously been stopped, but another prescribing physician reordered the medication. Josie's mother warned the nurse that narcotics were discontinued. However, the nurse gave the medication anyway. Josie ultimately died due to an inappropriately administered narcotic, in addition to severe dehydration. Multiple errors were made throughout the care process due to lack of communication between nurses, physicians, and the family.
That's a terrible story, but it does serve to illustrate the importance of QSEN and why it was developed.
Yes, and what exactly are the clinical competencies that are the focus of QSEN?
The first competency is patient-centered care, which focuses on attending to the patient's needs first and foremost, and providing care that honors each individual patient's desires, beliefs, and values. It involves seeing healthcare from the patient's perspective, allowing patients to have decision-making power related to their care, and empowering patients and their families to take a hands-on role in their health. The second competency is teamwork and collaboration. This involves working as a team with other nurses and healthcare providers and professionals to achieve a common positive health outcome for a patient. To accomplish this competency, nurses need to communicate effectively and openly, understand their scope of practice and the scope of their coworkers, and leverage the strengths of others to overcome personal weaknesses. The third competency is evidence-based practice. This involves implementing the most current research to provide optimum patient care that is based on scientific evidence. This involves keeping up to date on nursing-related research and advocating for antiquated medical practices to be replaced by practices that are based on current science and research. The fourth competency is quality improvement. Quality improvement focuses on monitoring the outcomes of healthcare processes with the help of data collection. Nurses understand that continuous improvement of the quality and safety is achieved through designing and testing changes in healthcare. The fifth competency is safety. Through practice guidelines at the systemic level, as well as individual performance, this competency focuses on minimizing the risk of harm for both patients and the providers of their care. The final competency is informatics. Informatics depends on the use of technology and information sharing to communicate, manage knowledge, mitigate error, and support decision-making within the healthcare system. So how do you think all these competencies relate to the story of Josie King?
I think almost all the competencies could have been applied to the case of Josie King. If Josie's nurses and doctors practiced patient and family-centered care, they might have been more inclined to listen to Josie's mother when she expressed concern about Josie's condition, which could have saved her life. If the nurses and physicians had practiced better collaboration, such as performing their rounding together at the start of each shift, then the nurses would have been aware that the physicians stopped prescribing narcotics for Josie.
Live in the studio is Bob Montgomery. How you doing, Bob?
I'm doing fine, thank you.
Good. That's great news. First question, I wanted to ask you, what is the most traditional nursing practice that is being done in your clinical area? In other words, what are the sacred cows, if you will, that are in your practice?
Well, sacred cows are gradually being knocked down one by one, but there's still a lot of things in nursing that are being done because we've always done it that way. There's no real science behind them. And those practices still exist.
Gotcha. Are there any in particular that come to mind?
One of the things that was being done until shortly before I started is they were still using sterile sheets because that was thought to lower the infection rate. Turns out when it was finally studied, it made no difference whatsoever. We used to see a lot of sterile wound care being done, and the studies have shown that sterile wound care doesn't make any difference in the outcomes. And in fact, it's usually the bacteria on the patient's skin, the native bacteria on the patient's skin, that contaminates wounds.
Interesting. So in your area of practice, they no longer do these procedures?
They don't.
Where at least where you were working?
You're right, right.
Wonderful. Well, that's good to hear. Next question is, why is the practice that we identified, why was it still being done? You kind of touched on it a little bit.
Yeah, it was being done because it had always been done that way.
Gotcha.
And that was sort of originally how everything in nursing was, is there was no real science behind it. There was no such thing as research into nursing issues.
It was sort of just a status quo.
It was just, some of the things that they're done and are still being done, go clear back to Florence Nightingale, and some of them are very good practices, certainly a lot of the hygiene things that are done. But a lot of them actually yield very little benefit once you actually study them.
Next question, sort of switching gears, what is the culture of safety in your unit? Culture of safety, if you know what that means.
Well, the issue with safety is it's unrelenting. You have to keep the pressure on all the time. Nurses do pretty well, but often when there's time pressure, safety things get overlooked. I know we had an incident on my unit where someone forgot to lock a bed, and an elderly patient who was ambulatory got partway out of bed, the bed rolled out from under him, and he fell and broke his hip.
Wow.
Which was a fairly disastrous illustration of what can happen when you're not really diligent about safety.
Especially with such a small thing that ended up happening.
Right.
I mean, it was just a lock.
Right.
So would you say that there's sort of a culture in the workplace, and I guess sort of in regards to like a just culture, to where who was responsible for that? Was it made more into a learning experience, or was it sort of a chastisement?
There's really no point in crucifying people for that, because then you just breed a culture where people will hide their mistakes.
Definitely.
Or try and pass the blame on to someone else. So there are efforts to do that, not universally applied, but I think that's...
In your institution, were they applied that way though, or generally?
Generally they were, yeah. If it was a pattern of someone who had been neglectful about things over a long period, often there would be action taken against the employee, but it was never on the basis of one incident.
Gotcha.
So
that makes sense.
And we used to see things like safety equipment not being in the room, and that's in some situations, created
be an environment conducive.
Yeah, it actually created situations where the patient was a great hazard. In one case, a trach patient, we used to have a lot of trach patients, was choking and there was no suction in the room, which is unforgivable, which should never happen. So.
Definitely. So the next question, what would you change, if you could, about your practice area in relation to competency of QSEN, which is the quality safety unit, or the culture of safety, so that kind of just culture we were talking about. Are there any changes that you think should be made where you were working?
This may not be intuitive for you, but the biggest change that can be made is to staff appropriately for the acuity of the patients. When nurses are overloaded, when nurses are responsible for too many patients whose acuity is high, they can't pay enough attention to the things that really matter. They're simply trying to keep their heads above water. And safety things get overlooked in that kind of situation. So that's the single biggest thing. People are expensive, and nurses are very expensive for the hospitals, so there's constant pressure from hospital administration to do more with less. But it's not always conducive to keeping patients as safe as possible.
Definitely. And lawsuits are more expensive than nurses, so.
Yes, true.
So that's one way to think about it. So, does your organization use QSEN or QSEN competencies? Is that a term you're familiar with?
Yeah, they're incorporated into some of the training that's done on the unit. And there is a lot of continuing training. Much of it does deal with safety issues. Both in terms of electronic modules and actual in-person training. So.
Gotcha. Awesome. Well, that's all the questions we have for you. Thank you so much for your time.
As I walk through the hallway of the hospital floor, I see them non-slip sacks, but no sign on the door. I know from research that is evidence-based that fall risk procedures make the patients more safe. I tell my nurse manager that this ain't okay, to which he responds, we've always done it this way. From these sacred cows around us, we must become free. We practice fall risk procedures cause it's EPP. In a culture that is just, we speak up freely to protect our patients and promote their healing. But I'm the kind of nurse that homies wanna be. Keeping patients safe is my priority.
Maybe we can save some lives living in a QSEN paradise. Trying to save some lives living in a QSEN paradise. Man, we can save some lives living in a QSEN paradise. Trying to save some lives living in a QSEN paradise.
Word.
Look at the situation they got me placing. Putting nurses in a box, working complacent. Informatics, data, they go hand in hand. Supporting quality improvement, you know that's the plan. Boop! Lights blinking, alarms are blaring. You better move in quick, dog, you better stop staring. When it comes to patient care, we're trying to improve policy. All the new policy informed by technology. Full quality improvements just a heartbeat away. Look at the data informatics. What do they say? 23 patients? Give me 24. Is that ratio safe? Yo, I don't know.
Tell me why we're blind to see these sacred cows around us are hurting you and me.
Maybe we can save some lives living in a QSEN paradise. Trying to save some lives living in a QSEN paradise. Maybe we can save some lives living in a QSEN paradise. Trying to save some lives living in a QSEN paradise.
We give that patient power, minute after minute, hour after hour. Everybody's running, working on collaboration. It's going on in the unit and at the nurse's station. If I gotta learn, then the healthcare team will teach me. But if you need my expertise, you know how to reach me. The patient's wants, the patient's wills, they put in front. We'll honor your request, fool.
Maybe we can save some lives living in a QSEN paradise. Trying to save some lives living in a QSEN paradise. Maybe we can save some lives living in a QSEN paradise. Maybe we can save some lives living in a QSEN paradise.
Tell me why we're so blind to see these sacred cows around us are hurting you and me. Tell me why we're so blind to see these sacred cows around us are hurting you and me. QSEN.